Hi, everyone. This is Sophia Kirby with Six. Just want to thank those who have already joined our webinar. We're at 2 o'clock now. We're going to give folks a couple of more minutes to join. So we'll get started in just a few. Hang tight. Thank you. Hi, Andrea. Are you able to hear? Hi, Andrea. Okay, I think we're going to get started now. Okay, so can someone chat in the chat box that you're able to see the PowerPoint? Great, thank you. Well, thank you everyone for joining us. For those who have not had the opportunity to meet me yet, my name is Sophia Kirby. I am the Deputy Director of Reproductive Rights at Six, and today we're here to talk about the state of Black maternal health in the US. As many of you, I'm sure, already know, we're coming up on our second annual Black Maternal Health Week starting this week, April 11th to the 17th. And we're really excited today to share a little bit of a sneak peek with you all on what to expect. So for a quick overview of Six, or State Innovation Exchange, we are a national resource and strategy center for progressive state legislators. And I have the pleasure of co-leading our cohort of state legislators called the Reproductive Freedom Leadership Council with Kelly Baden. At the moment, our cohort is a dynamic group of over 350 state legislators across 47 states who are really championing reproductive health rights and justice in their state legislatures. So if you're interested about learning more, please don't hesitate to reach out. I want to flag that as we're starting this conversation, where our movement is at a moment where the issues that we're most passionate about, reproductive health rights and justice, are in the news literally every day. And so I wanted to be conscious of naming that and thanking everyone on the call for all the work that you do. So if you can see on our screen our agenda that we're going to kick off today, who you'll also hear on the webinar, not just myself, but some dynamic folks from the Black Mamas Matter Alliance. I'll allow them to introduce themselves in just a moment, but this is the incredible coalition of organizations that spearhead Black maternal health and are really going to share some insights on the state of Black maternal health in the US and particularly dive into some of the policy prescriptions. Lastly, just a handful of housekeeping reminders. I wanted to flag for folks that this webinar is being recorded. So folks, your lines are muted, but if you have any questions, which I can see many folks on the line are able to access the webinar chat box, so just feel free to chat any questions you have in there. In a follow-up email, we will share a copy of the PowerPoint slides as requested, including any resources that come up and the recording of the webinar. And then lastly, I want to flag who the breadth of audience folks that are on the webinar. So we have state representatives, we have legislative staff, as well as state advocates, a wide range of folks who are passionate about Black maternal health and reproductive justice issues. And so with that, I will kick it off and introduce Elizabeth, who will start us off.
Thank you so much, Sophia, and thank you to everyone on the line who's able to join the webinar today. I apologize in advance if there is a slight echo. I am in a co-working space and there may be some background noise, but I will try to speak clearly and speak up. And if you have serious trouble hearing me, please type into the chat box. I'm really glad to be here today to talk about the work of the Black Mamas Matter Alliance. Is there a way for me to advance the slides? Okay, great. I'm on behalf of the Black Mamas Matter Alliance, and I want to start by sharing some data to help frame the conversation that we're going to have today. So you all have probably heard that Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. And this graph shows us that data. And it also shows us that maternal mortality has been rising in the United States. This is from 2007 to 2011, but it's been rising since the 1990s. And the disparity between Black and white women has only grown during that time. That disparity has always existed, but we've seen in recent years that it's worsened. One data point that I wanted to highlight for you all is that while maternal mortality has been, rising in most places across the country, there has been a decline in states like California and I believe North Carolina as well. But in California in particular, Black women have been left behind. While maternal mortality has decreased for all women, and also for Black women, there's still more, Black women are still more likely to die from pregnancy-related causes. So California made some investments in expanding healthcare access, health insurance access, and also in trying to address the safety of labor and delivery in the state, helping providers respond to obstetric emergencies and interventions like that. But whatever they have done, has not been enough to address what's happening with Black mamas and to address the root causes of disparate maternal death and morbidity. I also wanted to share with you all some interesting data from the CDC Foundation. They are working on an initiative called MARIA. It's a maternal mortality review system that will help standardize data collection across states to better equip us to make comparisons and to understand, exactly what's happening. And so they've gotten, they published this report in 2018, I believe early 2018, and, with data from 9 states that had participated in the MARIA project. And so this data shows us that there are differences in the underlying medical causes of maternal death for Black women and white women. And what we find is that Black women are more likely to be affected by heart disease, by preeclampsia and eclampsia, which are characterized by high blood pressure, and by embolism. Whereas white women are more likely affected by hemorrhage and surprising infection and mental health conditions. And I believe mental health, just quickly, one note, mental health conditions includes substance abuse as well as suicide or other mental illnesses. So the Black Mamas Matter Alliance is working to address these disparities, to address the root causes as well as underlying causes of Black maternal mortality and morbidity. And we center Black mamas in our work to be able to do this. We're a cross-sectoral alliance that's Black women-led. We advocate, we drive research, we build power and shift culture for Black maternal health, rights, and justice. And ultimately, we're hopeful that our work will help us accomplish and achieve a world where Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. As I mentioned on the previous slide, we seek to change policy, to cultivate meaningful research, to advance care for Black mamas, ensuring that care is holistic and comprehensive, and to redirect and reframe the conversation on Black mamas from one that blames them for their problems and to one that evokes empathy and tells the true story. And so here I just want to say, there's this narrative from the medical community and public health community that Black women are dying because we're obese, because we have diabetes, that we have high blood pressure, and that we're generally unhealthy and can't take care of ourselves. But we know at Black Mamas Matter Alliance that that's not the truth, that there are systems and policies and practice in place that are inherently racist, that are inherently discriminatory, and that block our access to tools that we need to be healthy. To tools, to services, and to high quality care that is free from violence and coercion and respectful and actually meets our needs. So Black Mamas Matter Alliance is grounded in reproductive and birth justice, and becomes apparent in our values. Our first values that we believe Black Mamas matter. It's going to be really difficult for folks to change what's happening on Black maternal health if they don't value the lives of Black mamas, right? Because that's going to shape how policies are created, how programs are implemented. And we are pushing people to recognize and understand, that Black mamas matter. We also fight for racial justice, reproductive justice. We recognize intersectional oppression, that race, gender, class, all collide to affect outcomes and experiences. We demand government accountability and policy change. And we do this work collaboratively, respecting community knowledge and leadership, understanding that we have resources and skills and capacity within our community to solve our problems. And we do this work with love and generosity. So I just wanted to quickly, you all are probably familiar as you're part of the Reproductive Freedom Leadership Council with the definition of reproductive justice, but I wanted to outline it here just so that we're all on the same page. Sister Song, based in Atlanta, Georgia, defines reproductive justice as the human right to maintain personal bodily autonomy, to have children, to not have children, and to parent those children that we do have in safe and sustainable environments. The Alliance is also grounded in birth justice, and according to Black Women Birthing Justice, that's based in Oakland, California, birth justice exists when women and trans folks are empowered during pregnancy, labor, childbirth, and postpartum to make healthy decisions for themselves and for their babies. And it requires us to dismantle inequities in race, class, and gender and sexuality that shape our experiences and outcomes. So I just wanted to also mention that Black Mamas Matter Alliance motto is to listen to Black women, trust Black women, and invest in Black women. And this is also a rallying cry and a framework for how folks can approach the work. You know, people often ask us, you know, what can we do? What can I do to support? You know, how can I help solve this problem? And these are really the 3 key steps. To listen to Black women, not only in healthcare settings, but in professional spaces where we're trying to solve problems and generate solutions. To trust Black women, that we know our bodies, ourselves, our communities, and then to invest in Black women in our leadership and in our ideas on how to tackle Black maternal mortality and morbidity. So the Black Mamas Matter Alliance is made up of over 50 kindred partners and collaborators, which are organizations all across the country that are working to solve the crisis that we are experiencing. So some of them are care providers, public health professionals, researchers, reproductive justice advocates, and other types of folks who have come together under this umbrella to strategize together and to you know, be in collaboration about how we solve the Black maternal health crisis. So currently there are a few challenges that are you know, specific policy challenges that we could explore. But I'll just quickly say that, you know, maternal health policy traditionally has been driven by physician communities, and it only takes a certain perspective. You know, looking at this issue from within the traditional medical context, but we know it's going to take some work outside of that context to really address, again, systems that perpetuate racism and discrimination and inequality. And so there's interest in health equity, but little health equity understanding. You know, a lot of the conversation has roots in patriarchy, and you know, many programs and policies focus on the baby and less so on the mama. And so we're trying to change that as well. And I already mentioned how some of the current narrative would rather blame the individual and the mama rather than address the systems change that is required. So we've seen, you know, a lack of investment in community-based initiatives and community involvement in Black women's leadership. So we've got a solution to that. In late 2018, the Black Mamas Matter Alliance Policy Working Group got together and, you know, sat down for a day and thought about, you know, what policy priorities can we put forth to help people understand the change that's required. You can go to the next slide. The first priority is to identify and ensure that Black women and Black women-led entities are engaged and prioritized in the program and policy development process as well as implementation. For far too long, policies and programs have been developed for the Black community without input from Black people. And so we're working to ensure that Black folks are prioritizing decision-making and that there's an investment in their time, expertise, and that we have the appropriate resources to develop and implement solutions. The second priority is to establish equitable systems of care to address racism, obstetric violence, neglect, and abuse. And what I'll say about this is that Black women's chronic exposure to racism, discrimination, disrespect, and abuse within the healthcare system, but also outside of the healthcare system, directly impacts our ability to exercise the bodily autonomy demanded by reproductive justice and birth justice, and to be active participants in decision-making about our health. And so we're interested in holding healthcare systems accountable for delivering high-quality, comprehensive, patient-centered, and trauma-informed care. Last but not least, our third priority is to expand and protect meaningful access to quality, comprehensive healthcare coverage, including the full spectrum of reproductive and maternal healthcare services for Black women. So this, for example, this is connected to ensuring that folks can access perinatal health workers, community health workers, doulas, and other paraprofessionals with insurance. And there's a big conversation about Medicaid covering doulas and covering, expanding insurance coverage to include the types of services and care that doulas provide. And so that's a really important conversation. And, we are supportive of that with some caveats that within programs that are seeking to expand Medicaid to cover doulas, that there be special considerations made for the most at-risk communities who might require the support of a community-based doula that has a different type of framework. And so there's a great resource that just came out from Ancient Song Doula Services in partnership with Village Birth International and Every Mother Counts, called Advancing Birth Justice, that's really, helping folks understand some of the more nuanced dialogue around, that it's not just enough to put programs out there to cover, to expand Medicaid coverage to doulas, but that there needs to be pay equity, fair pay for those doulas, that there needs to be other considerations for their participation in health insurance schemes, and ensuring that, once that the programs actually are accessible to the folks who need it most. You can go to the next slide. I want to quickly mention that last year, Congresswoman Alma Adams and then Senator Kamala Harris introduced the Black Maternal Health Week Congressional Resolution. And this was really fantastic because it was the first time you'd seen this kind of statement at the congressional level about some of the, what we call social determinants of health, the root causes of disparate maternal health outcomes, and racial inequality and racism as having a role in Black maternal health outcomes. And that resolution will also be reintroduced this week if it hasn't been already, and just in time for Black Maternal Health Week, which happens April 11th through 17th. And this is our second year doing that. And that's the time for us to have a conversation about Black maternal health, to raise awareness, to amplify the leaders that you'll hear from after me, groups like their organizations that are working on the ground to create change. And finally, I'll just mention that today we're actually supporting the launch of the Black Maternal Health Caucus at the federal congressional level. And you can tune into this, and some of you may not be in the local area, DC area, but you can tune in on the Black Mamas Matter Alliance Facebook page at 4:30 p.m. We'll be talking about Black-led models of care. And I just wanted folks to be aware that this caucus was happening. You might see some news reports coming out today. There was a press conference this morning. And would love for you to engage however you can. It may serve as a model for some things you want to do in your state. So that's all I'll share. And I'm really grateful for my colleagues in the Alliance, Jessica Roach and Andrea Williams, who will be speaking about some of the work that's happening in their state.
Great, great. Thank you so much, Elizabeth. And particularly, I appreciate how well you broke down what actually is reproductive justice as a framework and how the Alliance uses RJ and birthing justice as a core lens in which you do your work. I think oftentimes across our movements, RJ is very often thrown out as a framework that people should think about and should use, but unfortunately, it's pretty rare that we have that grounding in what the framework actually is and how it can be implemented. So thank you for that. And now we will pass it on to Jessica.
Wonderful. Thank you very much. I appreciate the opportunity to be able to join my colleagues from the Black Mamas Matter Alliance to be able to speak with you today. Again, my name is Jessica Roach. I am the co-founder and CEO of Restoring Our Own Through Transformation. We are a reproductive justice and birthing justice organization dedicated to addressing Black maternal and infant health, located in Columbus, Ohio. We operate through three arms, through our direct service, policy and advocacy, and education. Just to note, as part of and building upon what Elizabeth has already discussed, an expansion of what it is, what we do with our education is not necessarily in the framework that is typically thought of in education for patient-based, but it's actually involving education for healthcare providers and public health professionals to be able to really address these social determinants of health as they are commonly referred to. We take that a step further and we discuss it from the place of the structural and institutional determinants of health that have actually created the consequences of the social determinants of health as we know them. Next slide. So Root's impact statement, just to give you an idea a little bit about what it is that we do here in Columbus and then across the state in advocacy and direct service. We accomplish our mission by providing direct services to our clients, public policy, education, and advocacy, in alliance with local and national stakeholders. What I did not mention previously is that I do take an active, engaged role as a member of our policy working group and also as the co-lead with Dr. Joya Creer-Perry on our care working group within the Black Mamas Matter Alliance. We go beyond the surface level risk factors regarding marginalized mothers, fathers, infants, and communities and addressing the root causes of these rates. We also directly address the structural determinants of health, and we work collaboratively to build quality relationships with families, caregivers, professionals, and paraprofessionals. To make that very simple, the basis of our model is that we believe and listen and trust Black women and Black families, and so we consider ourselves a family-centered organization dedicated to being able to have access to all aspects of reproductive health that is inclusive of abortion care access. Next slide. Again, we are a proud kindred partner of the Black Mamas Matter Alliance, and we have been for over 2 years at this point, and we look forward to continuing that work into the future. Next slide. Some of the examples that I wanted to be able to talk about today, in particular because what we're discussing in Black maternal and infant health specifically has a great deal to do with these terms that we're utilizing along the lines of racial equity. It's one of the reasons that we believe that the Root model and other models within the Alliance, such as Ancient Song Doula, Mama Toto Village, the Afia Center, etc., work because it really does steep inside of working for us, by us. So our organization is Black women-led. We are an all Black and people of color organization. We come from interdisciplinary professions such as public health, public policy, OB/GYN, primary care, etc. And we utilize this model to be able to provide the service in conjunction with and in relationship with our clients. So we put their needs first and what we consider that patient bill of rights. That is the forefront of how it is that we need to operate in not only treating our clients, but also developing policy and advocacy around the overall treatment, in particular when it centers Black maternal health. Some of the things that we're doing on a state and local level, first of all, is exploring opportunities for Medicaid reimbursement for holistic doula support services. I want to stop here because I feel that this is important. The term has been coined by my colleague at Ancient Song. Doula services that not all doulas are the same. We provide perinatal support. So our relationship with the clients and the basis that we start with and what we believe is really the best access to care for our community and addressing these health disparities revolves around perinatal support. So not only do we start with the families at the beginning of their pregnancies, but we work with them well into the postpartum period, into early childhood development with young children, and then also help provide what we would consider comprehensive sexual and reproductive health care, advocacy around issues and structural determinants of health, such as incarceration, law enforcement interaction, issues that create the stress and the physiological manifestations of that stress that impact our health and well-being. And so in having these conversations in Ohio currently that does not have Medicaid reimbursement for doula support, we're really actively engaging in how it would be that we define what holistic doula support would look like, in particular for Black communities. What we do have currently is a very robust home visiting model that is reimbursed by the Ohio Department of Health, but that's through a general fund. And labor and delivery services are not included in that. So as of right now, our doulas will often, if not with a very small fee for service that is extended to our clients, if that fee for service is not able to be paid for, it is coming out of a community fund that has been developed within the organization. We are a public charity, so we have support of local donors that want to continue to see these services happen for our community. But as of right now, the Ohio Department of Health is not reimbursing labor and delivery services. It is important to note that we do have some states throughout the country that have started with Medicaid reimbursement. Some of the concerns and the issues is the very low rate of reimbursement for these doula services. And when we take a look at it from a cost benefit analysis, those states that do have at least a higher reimbursement, a little bit of a higher reimbursement or acknowledgement of the necessity and need for doula support, in those states, we've actually seen that the overall cost to Medicaid has decreased significantly over the last 5 years in the trend. So that's part of what we utilize in our argument for the advocacy piece here in Ohio, is that it would be overall beneficial to the overall cost on the Medicaid system to be utilizing a holistic doula support services, in particular for Black families. Some of the bills that we are working on, either working on in conjunction with, working to expand, or working to oppose, I've listed here. There are several that are coming through Ohio currently at a very rapid rate. And so with this, I'm only outlining a couple of the ones that are the standouts currently. The first one is SB 18, which has been introduced by Senators Antonio and Lehner. It is regarding incarcerated pregnant persons and shackling. However, the bill is limited. Senator Antonio currently is not interested in doing a companion bill, but we do have some options with Representative Erica Crawley and a couple of other members of the House and Senate that are very interested in some of the other explanations and rationales that we have around the bill, inclusive of extending these limitations and shackling to at least second trimester women. Currently, it's only for third trimester women. It is at a very subjective, subjective discretionary place, and it does not include the use of doulas for incarcerated persons, which is some of the suggestions that we have put forward as well, in order to assist with some of what the feedback has been on this bill and concerns about potential flight risk. We believe that that may not necessarily be the case, and in the cases that there is that potential, having holistic support services from a doula that is trained in being able to work with incarcerated persons and having it informed by incarcerated pregnant persons would be extremely helpful. SB 23 is also another bill that is currently just passed the Senate floor as of the last hour. I was involved in the testimony there, which is a total abortion ban after detectable heartbeat. Currently, as that bill stands, there is no exception for cases of rape or incest. There is exception for threat to life for mother, but that again is also subjective and not well defined. We have a great deal of concern in regards to, from a standpoint of reproductive justice framework, we have a great deal of concern. And one of the things that we want to emphasize is that we believe that it is incredibly important, especially when you're talking about the 400-year timeline that has impacted those of African descent within this country that have had their reproductive rights dictated to them and not had the opportunity to be able to choose where, when, how, and if we create a family. That bills similar to SB 23, which could very well be signed into law in Ohio by this Friday from Governor DeWine, actually continue to perpetuate what it is that we talk about in regards to those structural policies that are embedded in the framework that allow for some of these legislations to be introduced and ultimately be voted in. HB 90 is also another bill that we are taking a look at. Ohio is currently the only state that does not have a health curriculum. That is to say that is different than a sexual education curriculum. We do not have a standardized health curriculum. HB 90 was introduced and would require Ohio Department of Education and the Ohio Department of Health to create a health curriculum centering the humanity of the unborn child. And with that, we have asked for some resolution and had pushed some questions as far as who would be consulted. Currently, any organization that would offer either opportunity for access to abortion or education on access to abortion would not be eligible to help inform this health curriculum. HB 182 is a ban for insurance coverage for abortion. The language inside of HB 182 also includes any birth control that could prevent implantation. It also includes a very special rider in regards to treatment for ectopic pregnancy. And there would not be, this ban would also cover, and there would be a ban on insurance coverage for the treatment of ectopic pregnancy unless it was considered a threat to life. And the language specifically states that they would cover insurance if first option was to try for a reimplantation, which we have asked for the medical evidence in that. And so the majority of what it is that we want to see pushed as far as policy and advocacy is concerned is to try to take a look at this from one, the obvious place of the reproductive justice framework and how there are many aspects that impact our community as Black people that need to be taken into consideration when we are making the decisions about how it is that we want to create a family, but also making sure that we can provide safe and sustainable communities that our families can be raised in and thrive in versus trying to survive inside of some of the issues that, again, would address those social determinants of health. Next slide. And I put up this picture in particular because this is the image, this is our organization and some of our clients. This is really less than a third of our current clients and families. This is just to demonstrate what it is that we believe reproductive justice and birthing justice frame can provide. Our organization in and of itself, our statistics have already surpassed Healthy People 2020 in regards to maternal mortality and morbidity and infant mortality. And we believe that it comes from a place because of the fact that we are family-centered, that we trust Black women, we trust the families that they create. We do not try to define the families that they create. And we really steep in the basis of what it is that our community needs and advocate in that way, not only on the policy level, but in their direct care, to be able to center that patient bill of rights and make sure that each one of our clients is able to make an informed decision and do that with dignity and respect that can help reduce some of these stress factors that do cause a physiological impact on our health. And with that, I would like to thank you very much for the time today. And if you have any questions at the end, we'll be happy to answer them.
Great. Thank you so much, Jessica. I'm going to come back a couple of slides. I'll land here. And for our last speaker today, I will turn it over to Andrea, another Kindred partner who's based in Baltimore. Andrea, if you're speaking, we can't hear you quite yet.
Can you hear me now?
Yes.
Okay. Good afternoon, everyone. I'm Andrea Williams-Muhammad from Baltimore, Maryland. I am a national collaborator with Black Mamas Matter Alliance. And I thank my two colleagues, Elizabeth and Jessica, for what they have presented thus far. I'm going to be focusing on maternal mortality review committees and how we can increase the capacity and the impact of these review committees in regards to improving maternal health outcomes. So, as you all may know, maternal mortality review committees, as implied by their name, actually assess and review maternal deaths. While most of the MMRs that exist across the states default to the World Health Organization's definition of what constitutes maternal mortality. These definitions may vary from state to state on various levels. Here in Maryland, our definition is based on any maternal mortality, any death that happens within the first year of within the first year after a birth. We do not account for abortion, women who have had abortions and who may have died. And we also don't include women who may have had a pre-existing condition in some circumstances. And other states have chosen as well to define what they will include and what they won't include in that definition. Because the definition varies from state to state, within the conversation of community stakeholders' involvement in the review, it goes back to Black Mama Matters Alliance belief that Black mamas and their families should be included in all areas impacting their reproductive health and their birth and justice rights. What we have found in Baltimore specifically is that we currently don't have an MMR process in Baltimore, Maryland. We do have a state MMR process, which is very limited in scope, mainly because those who sit on the committee prior to 2018 came from the medical profession. And that was problematic for local jurisdictions because the recommendations in each report never gave actionable items in which local jurisdictions could implement into their programs and services, or to assess the success of their programs and services. Because at the table during these reviews, it did not include representatives from what we call we all heard of social determinants of health. So there were no social workers, there were no housing representatives, there were no community organizations that deal specifically with birthing persons, and there were no community members involved in that process. So in 2018 here in Maryland, in the 2018 General Assembly session, we introduced a bill that would expand our current process to include those stakeholders. While it has not been fully implemented, we are still in the process of deciding on who actually gets to be a stakeholder and how much power they have in providing insight and recommendations into the review process. And also in 2019, we also introduced two bills, and we just, as of last night, midnight, just closed out our 2019 General Assembly session, which we saw the passage of two bills. When we talk about Black maternal mortality, the one key issue that was not included in the most recent report submitted to the General Assembly was a sectional racial disparity. When asked by state and local leaders why this particular portion of the report was omitted in 2017, no one could give us a viable response or a lot of
I think your sound just broke out, Andrea.
that local jurisdictions could use in addressing the disparity within their jurisdiction. And also, in the 2019 session, we passed a bill that allowed local jurisdictions to create their own MMR process. For us here in Maryland, we felt, especially in Baltimore, we felt this was critical because we have a robust FEMA process, which involves members from the police community, the fire department, the local health department, the local social services. We also have members who are members of our city council, and we also have community members involved in that process. And what that allows us to do is to take a deep dive into every aspect of that death and where that person came in contact with systems that may or may not have assisted in contributing to a positive outcome for that infant. So the bill that was introduced and passed pretty much mirrors that process for us locally. So we are just really going to take our FEMA review board and transition it into also an MMR review board, where of the 30 to 40 members that are there, at least 60%, I would say, are actually community members or represent a community organization or a community partner with our local health departments, Be More for Healthy Babies. With that being said, these community members offer an insight that rarely gets seen by professionals, especially those in the medical profession, because they actually can speak to their own lived experience in interacting with these systems, and can give insight that many doctors often don't see or don't understand. And basically, those in the medical profession who are skilled and we appreciate their input, really they can't speak to the social determinants of health. And like Elizabeth said earlier, we need to shift the conversation when we have these reviews and not place blame on that birthing person, because there are a lot of things as a Black woman that may have contributed to that demise. And also, we also use the MMR process as a way to assess how we are doing in the city. In Baltimore, the Baltimore City Health Department's Division of Maternal Health, which is known as Be More for Healthy Babies, is in the process of doing a strategic 10-year refresh, where we're looking at current services and programs and how they are actually working, and whether or not they are achieving their set goals in reducing the disparity here in Baltimore City. While we experience maternal deaths at a statistically low rate, what we have here in Baltimore are deaths contributed to opioid use, which has had a long-standing history here in Baltimore, especially in the Black community. So, having community voice in this process adds benefit to the review process because of the vital information and insight that community members have in understanding the what, whens, whys, and how this mother did not make it. So once again, thank you.
Thank you. So appreciative of Black Mamas Matter Alliance for really going over some of the stats on the status of Black maternal health in the U.S., talking about some of the implications and the frameworks that are helpful to them, and then going in specifically on Ohio and Maryland, uplifting some of the policies that they are working with their folks with. Just a quick reminder, we're going to wrap up the webinar, but can folks please mute their lines if they aren't already? But wanting to go off of what folks were sharing, we invited some really phenomenal legislators who unfortunately couldn't be on the call today, but wanted to uplift some of the Black women legislators who have been working hard on these issue areas. And knowing that folks on the line also are working with legislators as well. So as I'm going through quickly, would love if people can utilize the chat box. Feel free to shout out any other bills that you're working on that have not been listed here so that we can figure out ways to support each other in advancing those efforts. Or feel free to use the chat box to uplift particularly any Black women legislators that you have been working really closely with or that you know of that are championing these important issues. So quickly wanted to really uplift some of our leadership in Florida, Representative Brown, Joseph, and Minority Leader Gibson. as well as some state partners on the call, have been working hard on HB 519, Maternal Mortality Prevention Task Force. This bill would create a task force that aims to evaluate methods, improve current practices and procedures, programs, and initiatives, all geared towards reducing the rate of maternal mortality. We also want to uplift some of our folks in Illinois, Senator Hutchinson and Representative Flowers, come pushing through several bills that are explicitly looking at maternal and infant mortality. The hospital report card bill, would require hospitals to keep detailed records on infant and maternal mortality, and also note any disparities along racial ethnic lines. So again, what we've been talking about on this webinar, uplifting any disparities that we're seeing happening. SB 132 would focus on continuing education programs to teach doctors and nurses about implicit bias, but not just about what it is, but the impacts that it can have on providing care. So really forcing healthcare providers to think about ways in which they internalize structural racism and the implicit bias that they develop naturally, and how that might impact their ability to provide quality care. And lastly, in Illinois, one bill that we wanted to uplift, SB 1909, would continue Medicaid coverage for new mothers for up to 12 months post-birth. At the moment, you're only covered for 60 days post-birth, and this bill includes a pilot program around supporting new mothers, particularly those that identify as low income, with voluntary in-home visits for additional support, as well as other services. We have some really wonderful champions in California as well, the California Dignity in Pregnancy and Childbirth Act, which I believe they also had a launch on this bill yesterday morning, would require healthcare providers, including midwives, nurses, and physicians, to receive implicit bias training, and to do so every 2 years or as the program feels is needed. So if they feel like 2 years is not enough, they have the discretion to do it even more frequently. So again, wanted to uplift some of the implicit bias policies that we're seeing as a trend, and thinking about ways in which there might be other opportunities to replicate it in other states. And lastly, wanted to uplift Representative Miranda from Massachusetts. SB 1182 would include Medicaid coverage for doula services, which what we've been talking about a little bit on this webinar would be crucial to expanding healthcare. And I want to thank folks in the chat box who've been uplifting a number of great legislators. You have folks from Ohio, Representative Sykes, Representative Kent Carley, Thank you, Lauren, for uplifting the alternative sentencing for pregnant women, a bill of part of the larger Dignity for Incarcerated Women legislative package. It's happening in Pennsylvania. Thank you, Representative Lee. These were coming in. Yes, I love it. Pennsylvania also hosts policy hearing on meaningful solutions to maternal mortality. We've got some sponsors, some leadership out in Maryland. Andrea is pulling up. Thank you so much for that. What I'll do is I'll be sure to pull in all of these links that you all have shared on the impact that state legislators are pushing for maternal health, and make sure that folks have access to all of these. Great. And as we're wrapping up, wanted to make sure that you all have our contact information. I realize now, I apologize to Andrea, whose contact information is not listed, but in the follow-up email, which will include the recording and the PowerPoint slides, I will be certain to include your contact information. So my apologies for that. I do want to plug, so there will be lots of activity over on social media. So please follow at 6repro as well as at Black Mamas Matter, and the hashtag for Black Maternal Week, hashtag Black Maternal Health Week, and hashtag BMHW19. I also want to open it up one last time to Elizabeth, Jessica, and Andrew. If you want to uplift any of the other online activities or on-the-ground events that you all are hosting that you want to share with the audience, I want to open it to you all for the last couple of minutes to share.
Hi, this is Elizabeth Gay. I will also add to your list of hashtags to follow hashtag BMH Caucus. That's where you can find the conversation that's happening about the new Black Maternal Health Caucus. And there's certainly a lot of chatter about it today, and there will be throughout the week.
Great, thank you. Any other Black maternal health related activities that maybe folks on the webinar who are not presenting? I know that there are tons of events happening all over the country, so feel free to unmute your line for the last couple of minutes and share out any events that you'd like to share with the group.
Hi, this is Jessica from Root, Columbus, Ohio. And I'm just going to put in the chat box our website so that you can go and take a look. Not only do we have our events that we're hosting here locally in Columbus, but we also have a link that goes directly to the Black Mamas Matter Alliance, where you can have an opportunity to see what's happening in your state or closer to, as well as some online activities. And we welcome you to take a look at those at your earliest convenience. It's going to be a really full week across the country, and with many of our members, our kindred partners and collaborators in the Alliance participating. So we plan to have a very robust week. So thank you again so much.
Great, thank you, Jessica. Anyone else would like to uplift events that they're working on this week? Okay, hearing none. I really want to thank everyone for taking the opportunity to join our webinar today, hear about the state of Black maternal health, and also figure out ways that we can support each other's policies moving forward and support each other's weeks of action as they come up. So keep an eye out for a follow-up email that you will get from me. Again, it will include all the links that folks have put in the chat box, as well as a recording and the PowerPoint slides. So thank you and enjoy the rest of your day and week. Take care. Goodbye.